Hello everyone, welcome to a new session in the series of medical education, that is tutorial and small group discussion. Myself Dr. Tushar Kala, MD Community Medicine. So let's begin our session. Specific learning objectives are to understand the concept of tutorials and small group discussions and how to maximize the utility of these techniques. Now tutorial, so T say T, so it is a teacher-centered activity conducted after a few lectures and series of lectures. So series of lectures हम ले लेते हैं, फिर उसके बाद में एक tutorial रखा जाता है in order to find out the extent of understanding and learning achieved by the students. Teacher may clarify some doubts in the tutorial, and mini teaching can also be taken by the teacher. So we have to be understanding and supportive to the student rather than critical and negative approach. And day-to-day assessment of each student should be done, and negative marking for remaining absent without valid reason. It can ensure regular attendance and effective participation. Now next is a small group discussion. So small group discussion is a student-centered activity. It is used to foster active learning by the students, and purpose and process of small group discussion should be shared with the student in a clear manner, and learning objectives should be clearly defined to the student. And activity should be managed by a group leader from the student, and role of teacher is only as a facilitator. Now group role can be assigned to the team members, that is one will be a leader, one will be a recorder, one will be timekeeper, one will be information seeker, encourager, compromiser, and standard setter. And these are some dysfunctional roles, that is aggressor, blocker, recognition seeker, dominator, knows all, uninterested, and cynic. Now maximizing the utility. So how to maximize the utility of these tutorials and small group discussion? So we have to formulate clear objectives for the course. We have to use variety of approaches during each sessions. We have to develop clear expectations, so what we expect from the student and how we will test them. Then student learn most when they take active part in the learning instead of being passive recipient of information. Then critical thinking are necessary, and formulate and communicate your expectations from student. Avoid yes or no questions and ask why or how questions. Very important, why and how questions हमें पूछने हैं rather than yes or no. And do not fear silence. So we have to wait for some time in order to provide opportunity for students to think and articulate. And we have to set up room for discussions. A circle works best if the group can sit around a table and discuss the topic, and provide positive feedback for participants, and show enthusiasm. We have to show enthusiasm for the subject as a teacher, and we have to assign roles to the student, and roles should be self-managed, such as leader, timekeeper, recorder, and a reporter. My references for this presentation are Principle of Medical Education 5th edition by Dr. Tejendra Singh. Thank you everyone for listening. Like, share, and subscribe to my channel.